Hey everyone, you're here with Dr. Devin Barley, and we are talking a lot about arthritis in this video series. And arthritis is such a blanket term, and there are many different causes, whether they're mechanical or chronic repetitive stress over time induced, or systemic, something like an underlying disease process that's occurring and causing arthritis to happen. What I will say is that, very simply, arthritis is additional formation of bone in response to stress, whether it's stress chemically or stress physically. The number one type of arthritis that we deal with here in the office is osteoarthritis, or sometimes known as degenerative arthritis. And basically what this is over time, as you kind of overwork the joints in your spine, your body's going to perceive that as a level of instability. And so what your brain does is it says, what is the strongest thing I can make to basically support this area? And typically it's additional bone. And so when that happens, the joints will kind of bulk up, especially in the spine, but it can happen in any of your extremities. And as that happens, you get this sort of crowding and stiffening in an area. And so what we do know is that lack of range of motion, especially in the spine, is going to perpetuate the formation of arthritis, because what you can't do as you start to lose that motion is pump out swelling, pump out inflammation. So put simply, arthritis broken up is, arthro means joint and itis means inflammation. So it's a little bit more complicated of a process than that. But what we do know is that when you have good quality function, good range of motion, we're able to stave off to a degree the arthritic process, but also improve the function for where you are now. And typically what arthritis may feel like, even though it doesn't necessarily in and of itself cause pain, is number one, stiffness, right? Stiffness in the morning, you kind of warm up throughout the course of the day, and then towards the end of the day, you'll start to feel stiff again. That's typically the story that arthritis tells. A couple of the other ones can be, potential muscle tightness or pinching in certain areas as that bone formation starts to kind of crowd the nerves in a specific area. So here at Greenwich Bay Chiropractic, the number one focus for us is, one, how do we get this joint, right? You can see it here, right? All these bone spurs, additional bone formation, that nerve is crowded, that disc is thin. If we're going to compare it to, let's say, normal, right? Normal anatomy, nice, wide and open, big fat disc. How do we improve the function of that area such that we can reduce symptoms? And the number one way is obviously the chiropractic care. So we're going to assess misalignments in the spine, areas of your spine that aren't functioning well or moving, and we're going to restore that function in there, not only to help that area specifically, but to help the areas around that arthritic area even up in function. And so we take some pressure off those areas as well. The second thing we do is we also offer decompression therapy. So very simply, this therapy is a computer-run protocol, and it's designed to open and kind of oscillate the disc spaces. So oftentimes with arthritis, if it's in the spine, you're going to also see that disc start to wear down. That's called degenerative disc disease. The decompression is going to help gently, safely kind of create a little vacuum to open that space up and create some more mobility, stimulate and unpinch nerves, and get on top of pain. So those are two very simple things that we do in the office that really, really help with arthritis. We have so many patients. I would say 90% of our patients have some level of arthritis in their spine, because it's a really important indicator that something hasn't been functioning well for a long period of time. So if you think that, or that you may have arthritis, chiropractic here at Greenwich Bay Chiropractic is an absolutely perfect option for you. Thank you so much for listening. We'll see you on the next video.